SeniorLivingGuide.com podcast discusses topics which are relevant to the everyday lives of seniors and their caregivers. We are joined by experts who share their knowledge on a variety of issues. SeniorLivingGuide.com podcast offers solutions and resources to create the best quality of life as we age. And now, let's welcome your host, Darlene Mahoney.
SeniorLivingGuide.com is the most comprehensive online resource for seniors and their caregivers. We provide details on senior living communities to include retirement, assisted living, independent living, skilled nursing, memory care, as well as senior resources, home and healthcare solutions, all in one easy-to-navigate website, allowing you to decide which best fits your needs and connect you directly in one easy step. Visit us online at SeniorLivingGuide.com and start your search today. And I would like to express our gratitude to our podcast sponsors, Transmed Care Long Distance Medical Transportation and GoGo Grandparent. When a loved one with a disability or medical condition needs to relocate, Transmed Care is here to help with safe and secure nationwide medical transport services, while GoGo Grandparent provides reliable local rides, no smartphones required, with all drivers and vehicles screened to meet your mobility needs. Check us out at SeniorLivingGuide.com podcast. We are making sure that our seniors are getting exactly where they need to go. And today we are joined by Katie Hilliard. She is the Director of Healthcare Partnerships at Homestyle Direct, where she focuses on building collaboration that improve health outcomes through medically tailored meals and nutrition support. Katie is also a registered and licensed dietitian, bringing a deep understanding of nutrition's role in health and healing. Thank you so much for joining us today, Katie.
Thank you so much for having me. I'm really excited to be here.
I'm excited to have you join as well. One of the things that we're going to talk about, the main topic today, I think is going to be something that people really don't understand. So we're going to hopefully the goal is to bring some clarity around the term food insecurity, the definition. And if you don't know what that means, we're going to explain it all today, right?
Yes, I'm really excited to dive in and unpack what that means.
Okay, so jumping off the deep end. What is the definition of food insecurity for the layperson?
Yes. So food insecurity, according to the FDA, is if you don't have access to food, the ability to cook food, safe food, or the right or nutritious foods that support your health. So oftentimes we think about food insecurity being, oh, I just don't have enough food, but that's not always the case. Sometimes there is enough food from a quantitative perspective. There's enough calories in it, but is it the right foods to support your health? Do you have clean water in order to cook the food? Can you cook the food? Do you have the right utensils? So there's a lot more that goes into food insecurity. And people might be surprised to know that the most recent data that we have from the USDA is that just under 14% of Americans, about 1 in 7, are considered food insecure.
Okay, and that runs the gamut of just what you described.
Yes, and they do break it down to even very low food security, which would be more of what we stereotypically think being like food is running out, there's no money in order to buy food, or we're eating smaller portions in order to make food last longer. And that's about 5% included in that 13.5% of people who are struggling with food insecurity.
Yeah. So I think people, when they kind of think about that, they think it's just about hunger, but it's not, because there can be some people that could be perceived as having actually weight issues, being, overweight, that actually are food insecure because they're not eating things that are healthy for their bodies.
Yes, I'm so glad that you brought this up, because there is this perception that food insecurity often yields the thin person, the person looking malnourished because they're not getting enough to eat. But the reality is food insecurity does not discriminate against your body size, and oftentimes does lead to a larger body because it's about food quality. So we have food deserts, we have food swamps, which I'm happy to expand on what those kind of entail because they really do play into food insecurity within our country. But let's say you live in a food desert or a food swamp, you might have access to foods, but are they the right foods that are going to support your health, support you from a metabolic perspective, an energy perspective, a physical and mental perspective? If the answer is no, then you can still be food insecure and living in a larger body or a body that could be perceived as very well nourished, even though it's not.
Right. So let's break it down. So a food swamp is what?
Food swamp is where there is access to food, but not health promoting foods. So maybe we've got a lot of packaged foods, a lot of processed foods, gas stations, and quick marts that are going to have access to food. So food is present, but it's not the food that's going to be nourishing. We don't have the fresh fruits and vegetables. We're not having access to the whole grains, to the lean proteins. Those don't exist. It's more of those ultra processed foods that are available. That's often what leads to health challenges and people existing in larger bodies, even though they're still considered food insecure.
So let me ask you this question. So when you're referring to that, are you referring to that that those foods are not physically available or they are not physically affordable to the person in those areas, specific areas? It's the people that are living there are not able to afford to access the healthier foods. So the packaged foods and those types of things are what they're buying just because they're less expensive.
So that's such a good question, a really good distinction. Food swamp would be that those foods just aren't available. So the nearest grocery store, for example, is, miles and miles away.
Okay.
It's not local. It still could play into food insecurity. So someone can be food insecure and have a grocery store right down the road, but they don't have the money to purchase that. That wouldn't
Mhm.
necessarily mean that they're living in a food desert or a food swamp, but they can
Okay.
still be food insecure. But a food swamp or a food desert would be that those foods are not there. They don't
Okay.
have access to the fresh fruits and veggies either because grocery stores are far away or transportation or the stores that they have just don't carry them.
So that would probably be most likely in more rural areas, typically. You would.
Exactly.
Okay.
We think rural, but we can also think very urban. Like I did my internship in downtown Detroit, literally a couple exits off of 8 Mile. And Detroit will be considered a food desert, or I should say actually a food swamp, because they have gas stations, they have quick marts, but the nearest grocery store that's going to have fresh fruits and veggies and produce is very far away. People would have to take the bus or car, and it's not very accessible. So it is rural, but it's also some of our very inner cities that would be
Mhm.
considered food deserts and food swamps as well.
Yeah, I get that. I've been to Detroit as well. My son used to live there, and there's so many incredible restaurants and places to go and things like that. And there are no grocery stores in that downtown area, which is incredible because I know some cities have some of those grocery stores that are at the bottoms of even like big condos or apartment complexes. But I think a lot of that specific, some of the more urban, especially if they're older, they don't have those new constructions that can maybe facilitate a large grocery store. So, yeah, so you would really have to find like maybe a small food mart that may have just a few options, and those food marts are expensive if you can find one.
Yes, exactly. So now we're running into the issue of, okay, so the food is there, but is it accessible? Do they
Yeah,
have the money? Do they have the funds in order
yeah.
to purchase it?
Yeah, and it's specialized. They're usually more like of a gourmet type of thing. It's just a little bit. It's going to be a little bit pricier. You're going to be able to maybe get some wine and cheese and those types of things because it's going to be a little bit more targeted towards that type of client customer. So yeah, yeah,
Correct, exactly. And oftentimes, um, individuals who are living in either those inner cities or rural, they have different cultural or ethnic preferences, and that's something that comes into play too. Maybe they're not used to seeing the fruits and veggies that are standard here, and so there's also that hesitation of like, is is this a healthy food? I don't know.
Right. Exactly. Exactly. So we just talked about the food swamps. So let's talk about the food desert.
So food desert takes it even further. There, in the food swamp, there's at least access to foods, but it's not those health promoting foods. Food desert, there's really no access to food. So maybe it is a grocery store or excuse me, a gas station or a 7-Eleven that's available, and that's it. So your choices are the honey bun or the hot dog on the roller, and that's really the access to food that's available within that area. So
Mhm.
food desert is the extreme. There's no fruits and veggies. There's not even a ton of ultra processed foods because the options of food is just so
Mhm.
narrow, so limited.
Yeah, I was visiting Vegas several years ago, and I can remember we left Vegas, which is a metropolis for everything under the sun, to go visit the Grand Canyon. And the drive out there, we went through these like little tiny towns with, um, and I don't know how people lived out there because there's not a lot of tree coverage. It's deserts, but people are living there in small communities, and there was no shops, there was no grocery stores, there was not even a 7-Eleven. It was, I don't even know what they were doing for supplies. I mean, and it's an hour and a half, 2 hours or whatever to get to um you know the, the land of, things to buy. I mean, I just, and it's not suburbia either. I mean, I don't even know. It's not like you're going to hit up a Target or like a main grocery store. It really is just something totally different, and it's small, and it's going to be a small community little grocery store that you're going to have access to. So that something that you're kind of, I mean, does that sound like what I'm talking about?
Yes, exactly. And it's
Okay.
funny you mentioned Las Vegas. That's actually where I reside, is in Las Vegas.
Oh, wow.
Um,
Okay.
Yeah, and so I'll in my work I'll often drive out to these more rural areas, and you're right, we're driving out there and there is nothing, not even a gas station, maybe a pump, but there's not like a little store attached to it. It's literally just get your gas, that's it. So these individuals who are living out there, they either have to drive in to the larger city into Vegas proper, or we have a couple of smaller cities that are suburbia in the area, but it's far. So do they have access to a car? Do they have money for gas? How expensive is it? Are the foods going to even make it the drive home? We can't
Yeah.
really have anything perishable. It gets to 120 out here in the desert. Um, so you are correct. That would be a food desert. Absolutely.
Yeah. Yeah. Yeah, because that's a long drive, and you're right. You would have to pack like a freezer type thing in your car. Um, but you would think, man, if I'm going to do that, I'm going to find myself a Sam's Club or a Costco, or because you have to pack it up.
Exactly. And then how frequently are they able to get out here? Does that food run out before they're able to restock? Those are all the things that play into food insecurity.
And where do you store it?
Yes, where do you
Yeah.
store it?
Yeah.
Um, Most of the time, safe storage is an issue. Freezer space is an issue. Refrigerator space is an issue. So even if maybe there's access to those foods that are freezer refrigerated, maybe they're defaulting to the more ultra processed shelf stable food because that's what's going to last them the month. That's what's going to last them from a money perspective and stretch it further. So there's a lot of things that play into that access. It's not just are there grocery stores, but it is also are there grocery stores.
Yeah, no, absolutely. Oh my gracious. I just can't even imagine. I just, even driving through there, I was just like, I can't imagine living out here where it's just desert. But there are communities, and that's how they live. So it's always interesting to see, how different people live, and how that's their life. And it's, when you're sitting here in suburbia, soccer mom world, or whatever the case may be, there's always different lifestyles for everyone. So we've covered a little bit of the two different types of the swamps and the deserts. And the deserts, literally, as we just referred, literally going over deserts. So if they're not getting enough calories, or maybe they're getting too many calories, they're just the wrong calories.
Correct. Yes, it can be both. So food insecurity can kind of manifest in both ways, either not enough calories. So now we're looking at an underweight, malnourished individual. And I'd like to just define malnourishment for a moment, because it's often thought of as the really frail, really thin individual. Malnourishment just means poor nutrition. So it can be applied to any body size. Someone in a larger body can be considered malnourished if they're not having the adequate protein intake. Maybe their body composition is higher fat, lower muscle mass. So malnutrition is just kind of a general term, but it can be either poor, not enough intake of calories, or too many calories and not enough micronutrients, vitamins, minerals, the balance of carbs, fats, and proteins. And now we're having health issues, chronic disease, diabetes, cardiovascular disease, renal disease, that complicates nutrition needs even more. Because now what was generally considered healthy is no longer considered healthy or appropriate, because we have to consider these medical conditions. And so food access and food security becomes even more challenging.
Hi, this is Andrew Brainerd, owner of TransMedCare Long Distance Medical Transportation. We are proud to help make this podcast possible. When a loved one under medical care needs to relocate, TransMedCare is here to help. We offer the very best in nationwide medical transport with fully appointed vehicles and a team of caring medical professionals. At TransMedCare, nothing is more important than bringing your loved one home safely. Visit our website at trans-medcare.com.
We at GoGo Grandparent are so excited to be joining this podcast. With just one call to GoGo, you or a loved one can request a reliable ride anywhere you want to go. No smartphone required. All drivers and vehicles are screened and monitored to meet your mobility needs and can accommodate impairment equipment, such as a walker or a wheelchair. Plus, GoGo membership offers concierge services on meals and grocery delivery, as well as home services, which can include maintenance on your home, cleaning, gardening services. To learn more or sign up for GoGo, call 1-855-970-6294 or visit gogograndparent.com/SeniorLivingGuide.
Okay. So once these folks are experiencing these issues, it can lead to chronic illness.
Yes, there's actually a link between food insecurity and increased risk of developing a chronic disease. And so we already are seeing chronic disease as a challenge within our country. Tack on the 18 million individuals who are struggling with food insecurity, it just increases their risk of having one or more chronic diseases.
Okay. So what are some of the chronic diseases that are generated or come from food insecurity or long-term food insecurity, if that's not addressed?
Such a good question. And I would say diabetes is the first one, simply because both pieces are going to influence it. Either too many calories and not enough of the right foods, and too little calories, because what diabetes is it's an inability of your body to use insulin effectively. So if an individual is going too long without eating, that's going to impact blood sugar management. That's going to impact our insulin sensitivity. That can lead to diabetes. Mm-hmm. If they're over consuming, because maybe this is the one meal they get in a day, or it's a high calorie, ultra processed food, that's all that's shelf stable and available to them, that's going to lead to diabetes as well, because that's going to spike blood sugar. The more often they spike blood sugar, the harder it is for the body to have that insulin sensitivity and bring blood sugar down. So now we're dealing with diabetes, which can lead to neuropathy, which is the tingling or the poor sensation in fingers, toes. You think about diabetes-related amputations, that's because of neuropathy. So it really can spiral very quickly. Heart disease and hypertension, high blood pressure, a lot of these shelf-stable foods are high in sodium. They have to be in order to be safe from a shelf-stable perspective. Right. But now we're raising blood pressure because we're over-consuming sodium. Blood pressure and diabetes are the two leading causes of renal failure. So now we're having kidney issues, and the need for medical care, the strain on the individual from a quality of life perspective, it just multiplies. And so food insecurity really can snowball all of these challenges from a health perspective.
Yeah. So really jumping in on these food insecurities can avoid a lot of these issues.
Yes, if we're able to improve food security, we can minimize chronic disease in this country.
Right. So I think, and maybe it's just my misconception, or maybe it's just because I've started doing these and now I'm like just a lot more aware. I feel like this is something that just has really come to light, as far as really something that as a whole, this country's really started paying attention to, probably just like in the last 5 to 10 years, or maybe I'm mistaken. I really don't think it was something that was really addressed, that there's the cause and the effect. And then actually the effect of it, it's less expensive as a whole to address the food insecurity right away. It's going to save money on the healthcare, as far as like the costs on the healthcare system that it has on the long run if you address it on the upfront. And then you have healthier Americans anyway.
Absolutely. You hit the nail on the head. I do think we've seen it more so in the forefront over the last 5 to 10 years as we're realizing the opportunity for prevention.
Yes.
Oftentimes we're trying to play catch up and it's already too late. Now they've developed the diseases. Now we have to manage them. If we really can prevent by increasing access to not just food, but the right foods,
Right.
we can save, money from a healthcare perspective, but then also just quality of life improvement.
Right. Which is the number one. I mean, you really want quality of life. And if you can do that through food, but that a lot of it has to be education. So it really has to be educating people so that they have an understanding, because I mean, we're going to be really frank and honest. A bag of chips is so much tastier than a bag of broccoli.
Absolutely. I think there's, as a dietitian, there's a lot of things that go into that.
Mhm.
I jokingly say, I don't really have to teach people that fruits and veggies are healthy for you.
Right.
Most people know that, but it's how can we incorporate it in a way that is palatable, that is enjoyable, still supports your health, and we can make that accessible to individuals, because there is hyper palatability where our palate can change. If all you're used to consuming is oversalted foods, high added sugar foods, that's what you're going to prefer.
Right.
So if we can create that education, we can start to shift the narrative. But the other thing too is, from an education perspective, is like what to do with the foods. We could drop a box of fresh fruits and veggies, just produce, on the doorstep of some of these individuals. What are they going to do with it?
Right.
Do they know how to cook it and prepare it? Do they even know what the food is? So lots of different education pieces there for
Yeah.
sure.
Yeah. I know one thing that I do, and this is just for me, is part of my issue is just the ease of grabbing something, right? Because chips, you can open the bag, you're good to go. Crackers, sandwich crackers, good to go. There's so many, the stuff that's really bad for you is packaged for ease. I mean, it's super easy. Everything is super easy, right? Even frozen food that's not great for you. I mean, it's already cooked, it's ready to go. You just have to heat it up. You're ready to rock and roll. So I think it's finding things that are easy, just like that are healthy for you. So finding some of those little tricks. One of the things that I started doing is I started buying like the little fruit and veggie party trays from the grocery store, that they're like $7, and I can literally for 3 days have fruit and veggies for lunch and snack on those. And then have yogurt, and it's like a perfect lunch, and it's grab and go. I don't have to like go make a sandwich. I don't have to go do any of those things, and it's healthy.
That's one of my favorite tricks, actually. So I love that you mentioned that, is getting those fruit and veggie party trays, because it's easy, it's accessible, it's, quick, you can just grab and go. So it plays into convenience. The hope is that we can have those things more accessible to individuals.
Right.
And, in like the rural parts of Nevada that doesn't have access. But the one thing from an education piece I do want to touch on is frozen. So frozen fruits and vegetables, because they tend to be more accessible from a price perspective, they actually can be more nutritious than fresh because of the process of freezing. You deep freeze them, you lock in the nutrition. Fresh fruits and veggies are on a train, on a bus, wherever, or a truck, getting to the grocery store. They lose out on nutrients as they're ripening.
Mm-hmm.
And so there's oftentimes this connotation that frozen is always bad, but frozen can be more nutritious than fresh and play a really important role. So I always like to say, don't discount frozen fruits and veggies. As a country that doesn't eat enough fruits and veggies, period, I don't really care how you're getting them as long as you're getting them.
Yeah. No, that's a great idea too. I didn't even think about that. So, yeah, for sure. Just getting those into your home. So I know that one of the things that Homestyle Direct does, because I do want to mention this is something we've partnered with you guys here at SeniorLivingGuide.com on the podcast because you provide such an incredible service to seniors and anyone that really kind of, I guess, needs it from a medical standpoint, are medically tailored meals. And one of the things that you do provide is our meals that go directly to your home. So as far as like the food swamps and the food deserts, that's something that you can actually accommodate.
Yes, absolutely. It's one of the things that I think I'm most passionate about is being able to get that access into those food deserts and those food swamps. So the home delivered meal program, it differs by state, but it's covered by Medicaid, and usually it's under home and community based services. So individuals who meet specific qualifications have access to foods that are the right foods for their medical condition, and it's delivered directly to their doorstep, no matter how rural or how urban they're located. That's one of the coolest things, is that we can get healthful and health promoting foods to the doorsteps of individuals who would otherwise not have access.
Yeah, that's the good thing about the medically tailored meals, that you can order directly. I don't think that a lot of people, now there's other services that offer it. We just really partner with you guys. We just love your passion, the passion of everyone that I've ever spoke to and worked with in your company. So we like it that you're able to share this information with our listeners because there are options through Medicaid. So that it doesn't come out of pocket for those that don't have the financial ability to pay for it.
Right. It's an at no cost to the individual program. So oftentimes it's through waiver programs or through state Medicaid or directly through the Medicaid health plan. So it is individualized per state, but there's a lot of opportunity. And I think one of the biggest things is just educating that this is even a program that's offered. Ask your health plan, ask your case manager, because you might be eligible to receive meals directly to your doorstep.
Yeah. And that's why we talk about this, because we don't know how much our seniors and their families and their caregivers know that they may not even realize that they are considered food insecure. They may not even understand that. So it's educating them and say, hey, listen, I don't have access to this food. I am struggling with, maybe I'm pre-diabetic, or, I'm having some high blood pressure issues, or I'm at risk for that. Especially if you have like any family history, anything like that, it's, definitely a possibility. Let me check into this so that I can avoid these issues later in life, because if Medicaid is dealing with them on the upfront, they're not going to have to deal with so many issues later that are going to be even more expensive. So they're looking Medicaid from a fiscally responsible perspective, I'm imagining.
Yes, I mean, there's been several studies that have found, medically tailored home delivered meals can prevent hospitalizations, minimize ER visits, reduce the risk of needing after hospital visit care, like a skilled nursing facility or a long-term, acute care rehab. There's so many benefits from the fiscal piece. And, as we mentioned, from the quality of life piece, but Medicaid is very interested in that preventative piece too. Any way that we can save lives and save money, absolutely.
Yeah. And we really are interested in happier and healthier seniors and their
Yes,
families. For us, I mean, we just really want that higher quality of life for them, to be honest. So, and if they're healthy, that provides that. And if they're eating well and eating nutritiously, that's a big key.
absolutely. Eating is such a challenge as we age anyways. If there's anything we can do to simplify that and improve the health while we're at it, here for it.
Yeah, absolutely. Absolutely. So, is there anything that we didn't really cover as far as like addressing what food insecurity is, and then what any of those types of things? Is there anything that we didn't cover that you think that we should touch on?
I think the biggest thing that I'll just reiterate is that food insecurity is not just lack of access to food. It's the types of food.
Right.
Do you have access to cook food? Can you safely store food? So if you're thinking, well, I can go buy food, I've got a grocery store down the street, that doesn't necessarily mean that you have food security. If you're ever wondering or questioning, I don't know if the food I have is going to make it to the end of the month. Am I going to have money coming in time in order to buy more groceries? All of those things indicate food insecurity, and reach out about these programs because you might be eligible.
Yeah. No, that's perfect. I really appreciate that. Thank you for sharing that with us.
Absolutely.
And we really do want our listeners, if you want to check out Homestyle Direct, what's the URL?
It is homestyledirect.com, just www.homestyledirect.com. And we have a ton of resources on there for individuals. You can look at our menu and see all the options that we have available.
And it's yummy.
It's I eat them for lunch. So I will say they're good. They're very good.
So there you go. That's even easier than going and getting my little veggie tray. So
It is.
Oh my goodness. Well, thank you so much. I really, really appreciate you joining us today. This was such a great chat, and I'm glad that we could really deep dive into food insecurity. I've been hearing it for years and years, and I'll be honest with you, for a long time, I didn't know what it meant, and I didn't want to ask because I didn't want to look stupid. So I'm so glad that I finally figured it out, finally asked some time ago. And I thought, well, if I don't know what it is, then the average Joe doesn't know what it is, because it is kind of, I want to say, like more of an industry term, I think. So
it is. I just thank you so much for having me. It really is a more clinical term. And I just appreciate the opportunity to be able to share about this. And hopefully it'll help some seniors realize that maybe they have access to programs they didn't otherwise know.
yeah, perfect. Thank you so much. I really appreciate you joining us. And if you enjoyed this podcast and you learned something from it, please share with a friend or a loved one that you think will benefit from the information we share today. And we're also available anywhere you listen to podcasts, such as Spotify, Apple Podcasts, Good Pods, or anywhere you enjoy your music or podcasts. Thanks for listening.